Today would like to tackle the three global major issues the healthcare industry is facing today in 2015. So the thing is, if you look at the healthcare industry, you can notice three big issues. First one, there is not enough doctors per habitant in emerging countries, 0.1 or 0.3 depending on the country, out of 1,000 inhabitants. There is also some poor communication along the healthcare workflow process. The patient who has some rare and difficult disease are facing problems to get in touch with the right specialists, the right doctors, and this is really a huge problem that we need to tackle. The third problem is, I think, the digitalization challenge of the healthcare industry. What is important is that to understand that the doctors and the GPs are really overwhelmed by documentation in their along the healthcare workflow process. Now, if you look at the market, if you look at the healthcare market and the solutions that are on the market to tackle those three issues, the digitalization, the poor people who cannot afford the healthcare services, and many people who are facing difficult healthcare issues that requires a specialist, and they are not able to get in touch with those specialists. So they are struggling, going on the internet, looking on the forums, trying to find a solution, going from one doctor to the other, and not routed directly to the right doctor that will help them and give them the right diagnosis and the right treatment to heal them. So if you look at the solution today on the healthcare market, you have a couple of solutions. Healthcare diagnosis, which I foresee like a checklist for the doctors, but you don't have a comprehensive, a unique solution that is a centric documentation clinical system, providing to the doctors access to the patient data, allowing the patient with difficult clinical cases to contact the right specialist, and also no solution that is able to provide on I would say on smartphone for poor people in emerging countries like Africa, like Morocco, or Mexico, or any countries where people they just cannot afford the healthcare services. So if you think about it this way, we need to build a solution, a very innovative solution to tackle these three issues. And we are the only one. Since we've noticed those three issues, we came up with an innovative design solution. We designed a new solution with I would say cutting edge technologies. It's a cloud-based. We've invested a lot in the R&D. We have run a business analysis project with one of the top hospital in Brussels. We worked with a group of dermatologists and a professor over there to come up with an innovative idea. So we came up with a solution that does not exist on the market. It's a comprehensive solution, cloud-based, providing smartphone services, healthcare services to poor people, building bridges between patients with rare and difficult clinical cases with the right doctors, and also giving to billions of patients a health diary where all the patient data will be stored for life and for free. So if you want to know how we monetize this new solution, if you are interested to invest, you can contact us at info@aminis.com. We are actually in the phase where we are preparing the pilot, and we are hiring developers to build the prototype. We plan to launch the prototype by end of Q1 2015. We need 150 doctors to join the pilot, because we want the solution, as I mentioned before, we want it to be designed by the doctors for the doctors, because we think that life and health are priceless, and we want to revolutionize the healthcare industry by putting the IT on the forefront of the big challenges this industry is facing. We have splitted this solution that is called Clarinda. We have splitted it in two main releases. One release will provide document management system with elastic search engine to allow the doctors, the patient, with keywords to find in the database of 11,000 illnesses, to find the 3 or 5 probable, most likely probable, I would say, illnesses that are linked to the symptoms of the patient. We are also developing in this release so the cloud features to enable the doctors, the patient, to feed the patient database with pictures of the illnesses, for example, skin pictures taken from the mobile, and would be pushed to the cloud from the smartphone to the and seamlessly pushed over the different devices of the doctors and the patient. So we are very cautious in terms of privacy of the data and security. We have architects on board who've worked to enhance the cloud security to the highest level, and we also provide an e-dermoscopy because we will start with the dermatologists. So we will provide e-dermoscopy features. So what is e-dermoscopy? E-dermoscopy is the science that gives that brings IT and dermatology together. For example, if you take a smartphone, the e-dermoscopy is the taking pictures with the smartphone to diagnose a skin disease. In the release number 2.0, in the release 2.0 that we plan to launch in end of Q2 2015, we are really focusing on artificial intelligence and neural networks and big data. So we want to use the artificial intelligence features to to be able to add more value to the product by putting in input the patient data and using the Clarinda, embedding in Clarinda artificial and neural features to process these data and link and find the right diagnosis. So we are really trying to build a kind of virtual, or I would say artificial intelligent doctor that will complement the work of the real professionals of the healthcare, the doctors, and provide them, I would say, an intelligent artificial second diagnosis. Also, we want to promote through this artificial intelligence doctor, which will be embedded in Clarinda 2.0, we want to promote self-medicine, home medicine, because we believe it will really help to solve the bottleneck hospitals are facing today with lack of beds, and we want the people to really heal themselves through this solution for basic, I would say, and genuine disease, and also to use this solution, Clarinda, to build bridges between the patient and the professionals. If you are if you recognize yourself in those patient issues, you live in a poor country, an emerging country, and you have difficulty to contact the right doctor, or you cannot afford it. You have a rare disease, and you want to be in touch with the right specialist on the globe. Or if you are a GP and you want or a specialist and you want to get the benefit of a centric NHS document management system, please contact us. If you are an investor and you want to join this healthcare revolution program, also contact us. Our email is info@aminis.com, or you can call us at +44 7805 617733. Thank you very much.